Hi, my name is Wendy Altobello, and the information that I have for you today is something that I retrieved directly from a webinar with Dr. David Ruben. And he's a doctor at the University of Chicago Medicine, and it was specific on Crohn's and colitis in relation to the coronavirus. And I thought that was really interesting, and that's why I took some notes and I want to share it with you today. So he first gave some information about the virus, which is actually a new variant to the SARS CoV2, SARS CoV from the past, sorry. So it's not completely new, but well, it has mutated in several ways, of course. And we all know that SARS stands for Severe Acute Respiratory Syndrome. So we all know that it has some severe effect on the respiratory system, but we should not forget, and this is something that we don't hear very often, that in 50% of the occasions, it also has an effect on the digestive tract. And that's where the Crohn's and colitis issue comes into place, of course. So we also know that the disease comes in through drops of moisture, and it comes in through the lining of our respiratory tract, but also through our digestive tract. And that is also something that we have not heard yet. So the cells, as well in our respiratory tract as in our digestive tract, have receptors on those cells, and apparently in the respiratory tract and the digestive tract, those receptors let the virus just pass through. And it's still unclear why, and specifically at those places, this can happen. They're still doing research to that, but that's just a fact. And that's, of course, why it's important to do a good follow-up with Crohn's and colitis patients, because it appears to be the case that exactly the digestive tract is a place in the body where that the virus can actually enter and start doing damage. So this actually makes the scientists wonder whether this virus can be located in our stool as well. And if that is the case, then of course that also means that the virus can be transmitted via the stool, which is an important thing to know, of course. And that's being looked after right now, but they are doing research for that right now. Now, especially for the patients, what you should know is that the medicines that you are on, maybe you know this better than I do, but I know in many occasions I take medicines and I don't even know what they do. So there might be people watching this who don't know what their medicines are doing either. So those medicines are actually to suppress your overactive immune system in your bowel. With Crohn's and colitis, it seems to be the case that the immune system is overactive and sometimes not well regulated. So if a patient of Crohn's or colitis gets an infection on another place in the body, the immune system starts to become active, but it doesn't shut down anymore. So it's completely deregulated, and the medicines make sure that the immune system is being calmed down again. And it's because of this overactive immune system that inflammations in the bowel occur. And by taking those medicines, the bowel actually gets the chance to heal those inflammations. So it's not the medicines that heal the inflammations, it's the fact that the medicines reduce the immune system's activity, that the bowel has a chance to heal itself. Now, many patients seem to wonder whether they should stop taking their medicine because it might have an influence on their immune system. But this Dr. Ruben clearly said you really shouldn't stop, because we are not messing with your immune system. You still have an immune system. We are just helping it calm down so that it's not overactive. And in fact, if you stop taking your medicine, chances are reasonably high that your inflammations will come back, and that even increases the chance to catch the virus, because it facilitates the passing through of the virus in your bowel. So it's very important that you keep taking your medicine to prevent from inflammations to come up again. What he also said, and this is really interesting and important, what we see with corona patients, the severe damage to the lungs that happens in some cases, has to do with the immune system becoming overactive. And so it's exactly the fact that you take your medicines, keeping your immune system at a lower pace, which might also help you to prevent you from getting the serious damage to your lungs, because it keeps your immune system from becoming overactive. So that's very important. So it's important to stay on your medicine, except for one, and that one is prednisone. As he said it, what we know from the previous SARS outbreak is that a dosage of more than 20 milligrams of prednisone a day in relation to the coronavirus, the SARS virus of that time, was not a good idea. The relation was not so well. He didn't explain why. He didn't explain what happened, whether there was more susceptible to the disease or the symptoms were more severe. I don't know. He didn't say that. He just said that it's not a good idea to take more than 20 milligrams prednisone a day in these times of coronavirus, and that if you are someone who is on that medication with a higher dosage than 20 milligrams, it would be a very good idea to talk to your doctor about this and to ask him questions, because he probably also knows what happened with the previous SARS outbreak. So that's more or less the information that I can give you from this webinar. I'm not a doctor, I'm not an expert on this, but I do have a very big interest in this health issue, because I work with some products that have a good impact on the bowel functioning in relation to Crohn's and colitis. So I use it a lot. I use it with patients, and we have good results with it, and that's why I also try to keep track with everything that happens in the Crohn's and colitis world, and especially now linked to the coronavirus. But that also means that I do have some interesting people that I follow on Instagram, and interesting organizations that I follow on Instagram that can also provide you with valuable information. And if you are interested to know a few of those names or organizations, feel free to reach out to me, and I'm happy to share them with you. Thank you for watching. We'll see each other back tomorrow. Have a good evening. Bye.